First of all, I'd like to ask unanimous consent to be added as a co-sponsor for this amendment. I just want to talk about the cost estimates. You just mentioned that CBO said this will actually reduce the deficit. Just a quick word on previous government estimates. When they passed Medicare back in the mid-'60s, they projected out 25 years and said it would cost $12 billion in 1990. In fact, it cost $110 billion, 9 times the original estimate, off by a little bit. President Obama, of course, famously said that if you pass a health care law, the average cost of a family plan would decrease by $2,500 per family by the end of his first term. Those premiums are up about $3,000 per family. That's kind of a big difference, about a $5,500 difference. But in particular, I bought health care for 31 years as an employer, and what's really going to happen, in that CBO estimate, CBO estimates only 1 million people net will lose their employer-sponsored care and get dumped into the exchanges with huge subsidies. The decision facing employers is totally changed with the health care law now. The choice that employers have to make right now is, do you pay the $15,000 for a family plan and then try and comply with currently 20,000 pages of law, rules, and regulation, and they're only about halfway done. And I don't know whether you saw outside in Leader McConnell's office, he printed out that stack 20,000 pages high. So again, the choice facing employer, do I pay $15,000 for a family plan, comply with 20,000 pages of rules and regulations, or do I pay the $2,000 or $3,000 penalty, and I'm not exposing my employees to huge financial risk anymore? What I'm doing is I'm making them eligible for huge subsidies in the exchanges. If you make household income of $64,000, you'll qualify for a $10,000 subsidy. Now, I know that sounds great, but what it says is not 1 million people, but tens of millions of employees will lose their employer-sponsored care, because for an employer that has always kind of scratched their heads and going, why am I buying health care? I don't have to buy auto insurance or property insurance, but I have to buy health care to be competitive. That's no longer the decision. So again, tens of millions of people will lose their coverage in those employer-sponsored care, get dumped in the exchange. This thing isn't going to cost $1.7 trillion. It'll cost $2, $3, $4 trillion, and we simply can't afford it. So we should repeal the law. Thank you, Madam Chair.